Hello everyone, I'm Dr. Alvarez from endobariatric.com, and on this episode we will discuss if the sleeve stretches out with time. Now what we know is that some sleeve stretching is known to happen with time, especially with bigger and wider sleeves. But it is important to say that the sleeve will never ever stretch out to the original size the stomach had. Now, how much does the sleeve stretch out? The stretching of the sleeve has a direct relationship on how big it was made originally. Here is where the size of the bougie comes into play. The bigger the bougie used for your surgery, the more likely it will have some stretching down the road. The lower the bougie size used for surgery, the less likely it will have some stretching down the road. Now, what is a bougie? I did a video on this. I will place the link here so you can see the video that explains more on this. Also, important factors with sleeve stretching is the surgical technique used while doing the sleeve. It is important that the surgeon at the time of surgery removes the fundus of the stomach, the part of the stomach called fundus. That part is the most stretchy part of the whole stomach. But it also carries a good amount of ghrelin, the ghrelin hormone, which is called the hunger hormone too. If the fundus of the stomach is left behind, you will have a tendency to stretch out your sleeve with time, because that's the most stretchy part of the stomach, if you leave that behind. Now, patients with sleeves will notice that restriction is amazing those first few weeks after surgery. It doesn't stay that way. This is mainly due because of the swollen tissue of the stomach of the recent surgery. It is not your real capacity. As the swollen tissue comes down, as the days and weeks go by, the stomach will have more space to hold food. It will be, of course, still a fraction of what you used to eat prior to surgery. Now, some people may compare the stretching of the sleeve with the stretching of the gastric bypass but the cause on the Roux-en-Y gastric bypass is quite different. Both etiologies are totally different. Bypass patients who regain weight or stretch the pouch is quite different, since the Roux-en-Y patients have an anastomosis, or a connection of the stomach with the intestine, that will distend along with time, along with the small intestine that will enlarge in diameter, giving it more capacity to the patient. Since the sleeve lacks all these issues, you will just need to focus on healthy food, on wise decisions, and make the most out of the weight loss, especially those first 12 to 18 months. I hope this makes sense. What I'm trying to tell you is, even though you have a nicely done sleeve, you may regain weight if you don't watch what you eat, if you don't make wise decisions, if you graze, if you have a lot of liquid calories. So think twice on whatever you are about to eat. Makes sense, no? All right. So that's it for the question of the week. I'm Dr. Alvarez. Don't forget to subscribe to our YouTube channel for future videos, and submit your questions. You can find me on Twitter, on Facebook, here on YouTube, and I'll see you real soon. Take care.